So this is a case upper. Okay, you can see. Yeah, for all of you, upper is not easy, right? For real in real case. Okay, in reality, the upper is complicated. As you can see, this is the real anatomy. Okay, so we need to copy that to be the same like this case. Okay, but as you can see, posterior, it's you need to understand, you need to learn how to create a cups. Yeah, see, this is like a H, you know, this is H, phone H, and then like this. There's no plus like this. Okay, not like a lower. For first molar, lower have 5 cups, but for upper you have a 1, 2, 3, 4 cups. This is the biggest cups on the palatal nasal, and this is a small cups. It's for distal palatal, and this is distal buccal, and this is mesial buccal. So you need to learn how to create a good anatomy by practice in your home. Maybe you can carving soap, you can drawing, whatever you like. Just train your hand because you're still in self quarantine. So do it your time to do something good and learn from your works. Yeah, your training maybe. Okay, so today I will share you how to deal with this case. First, you need to know the design of preparation. Okay, this tooth is already designed, yeah, already prep. Okay, you can see like this. With the case, it's a mesial, and distal, it's gone. Maybe this is MOD. Yeah, MOD is the not easy case for daily practice, because you need to build the cups. You need to build the wall, the mesial wall, and then the distal wall, and then after that you have a class 1 situation. That's the point of the class 2. The class 2, it's how to build the good mesial wall, have a good contact also, and then distal wall with the good contact. So today I will show you with 2 type of technique matrixing. So all I have to do is how to choose the good matrix. Okay, for me, yeah, there is no good matrix in the world. Yeah, it's depends. Okay, it depends. For me, I always use the sectional matrix like this. Okay, same like the anterior. Okay, like this sectional matrix. So when I want to put in my restoration like this, so I always put this area in the cervical. Okay, in the margin, and this one, it's on the top of the occlusal. So I put it like this. Okay, this is for example. Okay, so like this, not like this. Okay, this is a wrong way. Okay, so I have many questions for you for posterior. If you have a deep cavity like a subgingival situation, yeah, you need to, yeah, maybe you need to give some retraction cord, or you need to crown lengthening to see the real cavity, the real margin. I think, yeah, you need to give some extra periodontal management. Okay, so if you have a deep cavity, yeah, maybe you need to know how to blood control. Yeah, so I really recommend you to build up first with gingival cords plus a hemostat agent to stop the bleeding, and then you can try put the matrix. Okay, so today I will share to you, yeah, how to put this matrix. Okay, so you know, with class 2 needs some wedge. Okay, so I have a this wedge. This is from BioClear wedge. Okay, so how to choose the good wedge? Okay, it depends the size. Okay, it depends how big the diastema, how big the gaps. So if you feel like this, yeah, I put like this. Okay, just you can see the contact in here. It's already good, I think, because my instruments cannot allow to go to through the gingiva. Okay, the wrong size is if you put too big. Okay, this is a large size. Okay, so you push like this. Okay, this is make the gingiva. It's like, you know, sometimes the gingiva it's still harmed. It is because you push so deep for this wedge. So I'm not using like so big wedge like this, because all my case I only use this one. Okay, this is the medium size. If you feel they have a gaps in here, so you can put some Teflon tape, and then make a circle, because I don't have a Teflon tape right now. So you can make a circle, yeah, and then put Teflon tape, and then you can go again, yeah, with the Teflon tape plus wedges. I really recommend you like that. Then you choose the so big wedge. Okay, that's not good for the gums. Okay, or your patient maybe still have a hurt after treatment. So what else? Okay, if you have a MOD situation, maybe what's the best matrix that you need to put to you need to choose? You can see this is, I have a Pro Matrix. It's from, I don't know, it's from where, by Aztec Innovation. This is like a Toffel-Mayer matrix. So I think this is a good way for you if you want to build MOD, yeah, like this. So you can put in here. This is wrong, okay, because this is the palatal area, so you need to put on the buccal area like this. Okay, so this is not original. I think this is not like Toffel-Mayer's universal, because they have shape a little bit rounded. Okay, so if you tighten, and then it will have a good contact. So I will show you how to put in this matrix. So you can make a big first. Okay, and then you can bending like this. Okay, so you can try to put in here. Okay. So I always do like this, yeah. If you feel the matrix, okay, you can see not stable, but you can push you can push like this, yeah. Push until the matrix reach the real gingiva. Okay, and then hold with the finger, and then try to tighten first. Okay, because if you're not tighten first, maybe the matrix is not as stable. Okay, so this is not a stable situation, so you need to tighten first. Okay, so I will push in here, and then I will tighten like this. I will zoom out. Okay, now I will tighten. Wait, okay, let's go tighten. And this is disposable, okay, after using once, and then you can throw to the trash. Okay, you can see the gingiva still showing, and you need to put wedge after this. Okay, so what wedge we will to put in the mesial? I think the buckle is no need wedge because they already have a tight contact in here, but in here you can see the gum still showing. Okay, so you need to you need to put a wedge. Okay, so I really recommend you to use this one wedge. Okay, I always put on the buckle side like this. Oops, sorry. If you, I'm not bring the tweezer or forceps. Okay. Now let's push. Okay, you can see they have a still gap, yeah. Still gap because the gingiva is shown. So what will you do now? Okay, I always push again the matrix, push again. Okay, push again, and then I will change the wedge. Okay, because the wedge not push the matrix so well, because they have they have gums appear in here, or maybe you can choose a little bit a bigger size. Okay, let's change the wedge. So you need to use your magnification to check first, yeah, and then after you have a good contact adaptation, so you can do edge and bond, and then you can fill with your composite. Okay, so let's change the wedge because the size, medium size, is not good, the contact in here, so I need to change a little bit bigger. Okay, so let's see. Okay, I really recommend you to use a rubber dam, because with a rubber dam it's very good to see you have a vision during restoration, and also there is no blood, yeah, there is no saliva, and it's very nice for isolation. Okay, so let's check the margin. Okay, this is better. See, very tight contact. Okay, they no gaps. See, and this one also, we don't need add any kind of wedge because they already have a good contact. So why I choose why I always choose the small size than the bigger size, because I love using the small size to keep the periodontal is not so under pressure with the wedge. Okay, because you know, after post-op situation, maybe your patients have a still sensitive with their tooth because yeah, they have a big cavity and class 2. Okay, so you need to give them information if you after post-op feeling class 2, maybe you can give some medicines. Yeah, maybe you can give some analgesic. Okay, and also for me, yeah, I always do class 2 with local injection. Okay, local anesthesia, I mean. So I will anesthesia. For example, I will infiltration in here. Okay, in here, infiltration buckle in here, and then palatal in here. And then, yeah, you can do restoration under local anesthesia. Okay, so I will show you how after this what is the next treatment, the next step, I mean. So you need to edge and bone. Okay, I don't have a edge and bone right now, and you need to check the contact, this one, okay, and this one, okay, and then you can see the margin. Yeah, you need to make sure they have a good contact. Yeah, so you can massage like this. Yeah, sometimes you need to bending like this, okay, to make sure your contacts it have a tight contact. So you need to massage like this. Okay, so what's next? I always put my flowable composite. Okay, any kind of flowable. So you can use bulk fill, you can use everything. So I put flowable only in the floor, yeah, the base in here, just a little. Okay, no need to bulk fill. Okay, just a little. Okay, so flowable for me, it's only for a base. Okay, and then before you want to cure, you need to spread well. Okay, make sure they spread well to the base. Okay, and you can do it at the same time. Okay, mesial and distal. If you're using sectional, I really not good situation, because you have you need to put a ring. You know, I don't like a ring. I don't like ring. See? Why? Because using ring, sometimes they will bending your matrix. Sometimes the ring is not stable. There's a lot of problem with that. So I love using like this technique. Okay, because this I love the simple things. Okay, so after this we need to build the mesial wall. Okay, very thin mesial wall. Why? Because if you have a thin mesial wall, so you have a good space for dentin area. Okay, in here area. If you make a wall, mesial wall, so thick, maybe you build like this, so there's no room for dentin. So after you put the flowable, so you can change into the packable. So I use enamel color. Okay, like this. So this is original. Original is I'm not heating. Yeah, I'm using Palfic Tokuyama. The color is A2. Okay, so this is not a heating composite. So many question, all of you, maybe Dr. Griya, you need to make it hot. The composite, the answer is no. I'm not using heater. So let's push into the mesial. Yeah. So you need to push well, make it homogeneous, make it thin as possible with this instrument. Okay, this instrument is the gray one. This is not the original LMRT, this is copycat, but this is nice. Why? Because this is cheap than LMR. I love cheap things. So yeah, I love to choose the cheap instrument. Then I need to spend a lot of money. So you need to push until they have a extent. Okay, kalau bahasa Indonesia itu sampai muntah gitu loh. So after this, you can see from this side. Oh, a lot of excess there. Okay, a lot of excess, so high point. So yeah, that's my yeah. I love to, because after I have an extension like this, I always remove like this. See, and then push again. I love put extend, yeah. Why? Because extend, it means you have a good adaptation. Jadi kalau padat gini dok ya, maybe I'm bilingual, okay? Because I'm from Indonesia. So dokter kalau padat gini ya dok, padat muntah gini dok ya tuh, nanti dia akan homogen. Okay, see, as thin as possible, and don't too high. Yeah. Oh, it's too high. So you need to remove again and again with your spatula. This is plastic instrument. Okay. And see again. See. They already thin and smooth, yeah. So this is my way how to make a good contact and good shape. Okay, see, they have a thin, very thin. Okay, why? Because we need to add here for dentin color. Otherwise, your composite, it will be like, yeah, grayish, okay, because too much enamel. So I love to using my micro brush to make it smooth, and I love to add my micro brush, not bonding, but this is a modeling liquid to model composite material. It is from GC Japan. I really recommend you to use this for your brush, for your micro brush, to make it smooth, yeah, easy to sculpting. Okay, don't too much, yeah. Okay, just a little, and then yeah, you can make a smooth again with brush. Okay, I love brush because it's very easy to handling the composite. Okay, make sure everything is smooth. Oh, I have a hair again in it. Sorry. This is not okay now then. So you can use also the brush like this, yeah. Make it smooth and around it. Okay, like this. See, from this side. Okay, don't too high. I mean, don't put your composite on the top of the matrix, like in here. Okay, this is wrong. So just following in here, follow this one. Okay, okay, you can make it rounded with your spatula like this. Okay, make it rounded. Okay, make it smooth and rounded. Sorry, I'm shaking because I am a tremor. See? And now, if you want to make a smooth again, yeah, you can use a brush again in here. You know, doing aesthetics, it's not easy. Yeah, maybe you need the time. So for me, if you're already pro, maybe you can make a faster aesthetic and fast. This is our goal. Okay, now I will cure. So when you want to cure, sometimes I'm doing like this. Sometimes I pushed. If you want to make a good contact, so I've push with my spatula. Okay, like this. I need my assistant. Wait. So sometimes I'm doing like this. Okay. You go. Yeah. Okay. To make sure I'm doing like this. Push like this. Okay, and then now let's do in this side. Okay. Apa ya? Okay, now this side. Okay, I need to add more. Okay, about the color, yeah, I know the color is not matching. Yeah, because this is acrylic and this is composite. Yeah, you cannot match very well. But if in the real tooth, in the real patient, it will be match 100%. Okay, just push like this, push, make it thin. Okay, make it thin like this. You can see they have an excess in here. So you can round it. Yeah, you can round it like this. Okay, make sure the same with this. Okay, you round it. See? And then make it smooth again with a micro brush. I love micro brush so much. See? And now you can remove again the excess. If you feel like, oh, maybe I have a excess in here, so you can make it rounded. Yeah, round, just round it like this. Don't too high, okay? Okay, so the last is a brush. Okay, why with brush? Because brush it's pointed, so they can make a sharp, yeah, like this. Yeah, so you can make smooth. Okay, but sometimes if you feel like, oh, too much push, so you can re-push. Okay, put back like that. Push back again, back. Okay. Now I will cure again. So sometimes, yeah, if you want to make a good contact, you can try like this. Yeah, try push like this. Go. Yeah. Okay. Okay, now we have a class 1 situation, yeah. So after this, yeah, you can remove remove the matrix, remove the wedge. See, you have like this situation. Yeah, it's okay. This is gonna be. I will finishing this side. See, I will finishing with a soft flex. Okay, you know soft flex with disc. It's very easy for you to like this, yeah. Thread, 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 and this one again. Thread, thread, thread. This side again. Thread, thread, thread. This one again. Thread, thread, thread. Okay, later. So now you don't need to do that. See the contact. See, I'm not lying to you. Okay. This one, I will finishing. Okay, you can use blade also. Blade, remove this one. Okay. Got it? Okay, what's next? Okay, next you have a class 1 situation. Okay, it's class 1 situation, so it's easy for you. Yeah, you can use flowable again. Flowable, it's only for a base. Okay, I love flowable because for me flowable is make it fast. Okay, so don't forget to use your instrument to make sure there is no bubble. sorry sorry terap. You can use your instrument to avoid the bubble. Okay, this is important, yeah, to avoid the bubble. So you need to use the sharp instrument and make sure they already covered all the surface, and then you can cure again. So I will use the dentin color. Okay, if you have a deep cavity, so posterior you need to add dentin color. Why dentin color? Because dentin color, it will covering all the discolorization situation. If you have amalgam discolorization, if you have affected dentin with brown color situation that you don't have to prep again, so the answer is using dentin color. So I use Ina HRI. It's from Italy. So I love using UD6. Yeah, I bring only UD3 because I just have only this color. But in posterior, mostly my case only using UD6 or A6. Yeah, UD6, it means high chroma dentin. High chroma dentin, it's like a yellow situation. Okay, so this is the dentin. So just push like this. Yeah, I will show you the secret when you stop at the dentin. Okay, so mostly if you already build cups all good, and then after you remove the rubber dam, and then after you want to adjustment, and then you will see, oh my god oh my god my restoration so high. and then I will remove again, prep, and then it will flat again. So that's not good situation, because when you put dentin color, it's too high, too high. So all you have to do is measure your dentin color only 2 millimeters from the top of the occlusal. So I will show you now. Wait, yeah. So this is too much, so you need to remove the excess. So usually dentin color, you can do with the one layer, and then you can put on one layer again, so you don't need to put like this, one bulky and then go covering all. You can put cups by cups, you can do that, but it takes time for you to put like that. So let's now let's see. You can see from here. Okay, from here. See from here. It's very clear. Okay. So if you this is the top of the occlusal. Okay. So you need to measure that the top of occlusal under the dentin is 2 millimeters. So you can use probe. Maybe I don't bring my probe. If you use probe like this, and you have a two line, and then two line, it means 2 millimeters. So if you build the dentin in here, it means it's already too high. So that's gonna be wrong. Okay, so you need to measure from this side. How you can measure with this side? Yeah, you can use a mirror. You can use mirror. You can use magnification. You can use dental photography. So you need to measure 2 millimeters from this into the bottom. 2 millimeters from top of occlusal into the bottom. If you don't have probe? Okay, if you don't have probe, you can use your microbrush. Okay, this is your microbrush. If you have all microbrush surface already, one microbrush one microbrush like this, one, and then one, and then one, tuh. Jadi dia udah langsung. Jadi kalau satu bola ini round, that all microbrush already put inside in here, ya, dia udah 2 mili nih, 2 mili, 2 mili, 2 mili. Oke ya, ngerti ya? Mudah-mudahan ngerti lah. Okay, so from this side, you cannot see the high level. Okay, you cannot see the high level. If you do upper molar restoration for posterior, you can see only with your mirror. So that's why I really recommend you to use your magnification, to use your microscope maybe, or your loupe, to see clearly. Okay, I will make a flat, because this is not still rough. Okay, so I need to make smooth with microbrush. Okay, so check again from here, and here. See? So you need to know this is the top occlusal, and you have 2 millimeters area, 2 millimeters, 2 millimeters, 2 millimeters. Okay, I think you already understand lah. Got it, yeah? So now if you want to make a map, why mapping? because mapping it's like easy for you to follow the line to create a cups by cups. If you in hurry, maybe you don't need to create a line, it's okay. But sometimes we need to create a line for guiding. Okay, so with sharp instrument like this, so you can stabbing like this, yeah, step like this. Okay, this is gonna be the distal. Okay. Okay, this is the distal, and you can see this line. Okay, this line is not plus, yeah. Plus it's wrong. A little bit like this, like this, see? This is not plus. Okay, so push like this, like this. Okay, and then this is the, I have a line in here. Yeah, you can stabbing slowly, yeah. Okay, wait. Okay, you can create again, because usually I'm using my file. Okay, we need the sharp instrument doing like this. Okay, and this is another line. Okay, like you can push like this. I think the composite's already set up. Okay. Oh, wait, yeah. If you feel like there's too much gaps, yeah, so you need to make it closer like this, yeah. Okay, so now let's cure, and then you can add yeah, you can add a stain, or yeah, for make it lines, yeah, for make it guidance, because flowable, it's a flow stain like this. Okay, okay, this is from Ivoclar like this. I already Empress Direct color. This is brown color. Okay, so put it don't too much, yeah, I'm afraid too much is a little bit dirty, just slightly like this. Okay, oops. Okay, this is dirty, yes, okay, this is dirty, but you need to, yeah, make it smooth with your instrument. If you don't want to use this stain, it's okay, but you need to tell to your patient, yeah. If your patient is not agree with you, yeah, you need to remove this stain, because stain, it looks like yeah, you have still have a brown situation, yeah, in the fissure. So that's not good for your patient if bahkan ya pasiennya kadang-kadang mikirnya ini belum ditambal itu. Don't too bold ya. I mean just a little, don't too much. So many question how to clean the brush. So you can use alcohol swab. Okay, alcohol swab, just with alcohol swab. Okay. Okay, now like here. Okay. So guys, this is already 45 minutes. So I will end it now, and then I will continue again because, yeah, I need to end because I want to save my video. Okay, I will end and then I will relive. Okay, stay tuned. Hello again. Sorry. Because yesterday on my anterior, I cannot save the video. Because of already 1 hour, and then the Instagram cut my video, and then I can't save it. So that's why I need to end it, and then I can save, and then I will continue. Okay, I will turn off the comment. So guys, I will waiting until 1000. Thank you for watching my live. See, good contact. You can use your floss, your dental floss, to check the contact, to check the tight contact like this, yeah. See, oh, very tight. See, very tight. See, nice. Okay, and now let's continue to build cups by cups. Okay, cups, 1 cups, 2 cups, 3 cups, and 4 cups. Okay, so for me, I always use the enamel color. Mostly I use A1, but now I have only A2. It's okay for practice. It's okay. In reality, in my life, in my case, I mean, you need the shade A1. Okay, so I love to create this one first. The bigs first. Okay, this one. Okay, so just add like this. Okay, and then swap with the alcohol swab to your instrument. Make sure they already clean, and then I will show you the technique, how to push the composite. So the movement is not like it is not like this, yeah. This is wrong. But you need to follow the curve, like this. Step, step, step. Don't doing this. This is only push into the top, go down. But you need to follow this curve, okay? So that's why I love this instrument, because, yeah, see, like this. Not like this. This is wrong. Okay? This is only push. Wrong. So you need to like this. So they will follow the curve line. See, like this. This is correct. Okay. Okay, but in reality you cannot see from this side. Okay. In reality you can see from this side. Get it? Now just fill again. don't covering this area. Don't cover this area. Only on at the line. Okay. Push like this. Push like this. Okay. After this, you can see from this side. Oh my God! They have a lot of access in here. Yeah, because you already push like this. Push, push. Yes, that's good. Why? Because if you have an access, so you can removing like this. Remove the access. I love access because hair. I love access. Why? Because with the access, it means your composite is already homogeneous. See, I have a lot of access. See, and then you can make sure you can adjust again, and always do brushing. Okay, brushing is very important. See, already nice. Yeah. So I always brushing. Why brushing? With brush, if you have a condition, I mean smooth condition, smooth composite situation, so you don't need to take time for your polishing. Okay. Always do like this. How about the anatomy? Do you like secondary anatomy? Do you like about what else? Bulky anatomy, or complicated, or muscle anatomy? It depends your style. Okay. So for me, I love the simple anatomy. Simple, it means you can make it fast, but and then you can get the aesthetic. Okay. Make sure. Okay, 1 cup's done, but I need to make a smooth again in here. Okay. Okay, now cure. Yeah, I always cure 1 cups, and then I cure. Cups by cups. Okay, let's cure. And I recommend you to don't feel stress during make it 1 cups. Don't touch so low. Don't too much touch. I mean, you confuse when you have you always touch your composite. Touch, and then you cannot follow your heart, your mind. Maksudnya gini loh, kalau kalian sering sentuh nih ya, kalian sentuh aja sampai kalian mikir ini kok nggak bagus-bagus gitu. Ya lama-lama dia nggak bagus itu. Jadi simple aja, yang penting simple, and then you just follow the line. That's it. Okay, now let's continue these cups. Okay. So I love after this, and then I create this one. Okay, why I love diagonal like this. Okay. Oops. Remember how to push. Oh, ada bulu. Okay. Push like this, yeah. Push like this to pop, not like this. This is round. Follow the curve, yeah. See, push. See, I have a lot of excess in here. Oh my god. It's okay, it's okay. I love to do excess, yeah. And I love using this one. Yeah, this is a spatula, okay. So you need to doing like this, yeah. Okay. Like this, follow the line. Okay. And then this one. Okay, then this one. Okay, you can see the line is already good, but they still bulky. They still high. Oh, so you need to make sure. Okay, you need to smooth first. Okay, and then remove the excess. Okay, how to remove the excess? It's easy, like this, yeah. Like this. So this is the excess. See? Otherwise, your composite, it will be overhanging, bro. So that's why you need to remove all the excess. This one. Got it? See from this. Oh, this is already nice, doctor. See? I hope this video is very clear for all of you guys, so you can understand. This is a basic for all of you. If you want to do aesthetic filling for posterior, okay. So after you have a good cups, and then you can make it smooth again. In here, yeah. Just follow the line. Okay, that's ready. That's done. And before you want to cure, don't forget always doing this, okay? Make it smooth again, smooth. Okay, now cure again. I will explain very clear and very simple. I hope you can understand. Now let's go to the other, yeah. After this I love to fill this one. Okay, distal. Like this, yeah. Then what is this? Hair. Okay, push again like this. Push like this. Free. See from here, yeah. See. Step. Don't like this. This is wrong. Not following this. You need to following like this. Stop. Like that, only like that. Very easy, right? And see, the excess, it will be show. Okay, that's fine. Oh, I need to retouch again like this. Okay, now you can see from here. Oh, I have an excess. Oh, doctor, too much excess. Banyaknya nih. See? Yeah, it's okay. Because after this, I want to remove all the excess, ya. Jadi, kelebihannya dibuang. Okay, so I will remove the excess. Like this, yeah. If you want to see how to remove it, like this. See? Oh my god. Very easy, right? Okay, so what's next? Next, you need to make the line. Okay, you need to make the line between the another cups. Okay, so you need to use your instrument, sharp instrument. Okay, I love to using this one. Okay, see this one? This is the green one. I think the name is fissura. Just follow like this. Follow like this. Follow like this to see. Very easy. Okay, and then follow to the design. Be careful, in here they have a small cups in here. Okay, so sometimes I doing like this. Okay, to stepping like this, step like this. See, they have another cups in here. Okay, but this is not good, so you need to make smooth with your brush. Okay, so you need this one to make smooth again. Can see? I need the brush, micro brush. Oh my god, I have a black hair. Oh my god, aku ada black hair. I don't know from where. From micro brush. But it's okay, this is only practice, yeah? No need to be perfect, so perfect. I just want to show you. Okay, so let's cure again. Let's cure again and then go to the another cups. Okay, let's continue. Where's my light here? Oh my god. Okay, now sorry. Okay, now I will go this one. Okay, this one, and then this little, and then this is the last. Okay, so yeah, you have a different style. Okay, you have a different, every dentist have a different style of the carving. But for me, I always do the simple anatomy, simple and acceptable. I don't like to add like you know, like secondary anatomy, like what else, so detailing, because yeah, you have a lot of appointment and you have a lot of patients, so you need to make a simple and faster. with a good anatomy also, correct anatomy. Okay, and you can see from here. Okay, I have a like access, so you need to remove the access. Yeah, always remove the excess. Okay, always remove this area, otherwise your composite, it will be overhanging. Okay, okay, now let's make a line again, okay, anak gua nangis lagi tuh. Make it line like this, slowly and gently. See, easy, right? Easy because you only watching. In reality, it's not easy. And sometimes you have a small cups in here, so you can you can do it like that. Just okay, then make it smooth again. Yeah. So sometimes you have a lot of too strong gaps. Yeah. Sometimes it will be like have a food infection or trap or like a fissure sealant, you know. So you need to make it. If you feel in here so too much gap, okay. So with brush, you can do it like this. Yeah, you can make it closing again, close. Okay, I need my lubricant. Yeah, like this. Actually, I don't like to use my stain. I put on the last layer because you know, last layer I think it's a little bit dirty. I mean, you put stain after all done. Yeah, you put stain after all done. I don't think that's good idea because it looks very dirty. Yeah, if you don't have a sharp instrument, I'm not recommend you to do that. So I'll always put stain color inside the dentin. Okay, I think this is already good. You can see. Yeah, this is for practice. Okay, I'm not very serious. Okay, just having fun. Yeah, during aesthetic feeling, you need out of stress. Yeah, you need to confidence. You need to happy. You need to use your dental photography to try to share to your friends or to your patient. That's good idea, I think, because you know, my patient, it's not for aesthetic before. I love surgery, you know. I love surgery. I love oral maxillofacial case. But after that, after I finish my dental school, and then I already be general practice. I only general practice. I'm not specialized. my passion it's on aesthetic. Even I can't drawing. I cannot draw. My writing is very bad. But I can do only for a tooth. I can sculpting because I train so hard. Yeah. I train every day. Okay. Now cure. And then the last is this one. Okay, the last is the this one. Okay, this is gonna be my last cups in here. But don't too hide, yeah, don't too hide. Check again, don't too hide. So guys, I hope you enjoy my video today, and I can save it and I can repost again on my YouTube channel. Okay, because on Instagram you cannot post 15 minutes video, so in YouTube you can post it 50 minutes. And I'm not so active in my YouTube because I need to focus only for Instagram. You know, I don't have any kind of management or who manage my Instagram. No, I do it by myself. There is no team who manage my Instagram. No, all I doing with myself. So okay, this is done. How about a polishing? Okay, polishing I will show you, but I don't have a burr. I'm using the flame burr, but I will show you how to soft flex. Okay, soft flex, yeah, like this. Okay, soft flex, you need to use your soft flex to make it rounded. You want to see my anatomy? Yeah, you can check. This is my ugly anatomy. See? Check again. See, this is good or no? Yeah, this is for practice. Yeah, no serious. Okay, so I will show you how with this disc you can make it rounded. Okay, make it rounded in here, rounded. Don't too so hard push it because it will dice them out. So make it rounded in here. See, easy, right? Oh, low bed. Okay, and here also. See? Okay, round it again in here. Okay, and here also last in here. Okay, or you can change this to the back side like this, and you can massage here. You can bending like this to make it a little bit curve. See, like this, curving, so they will following. Okay, if you see the new one, this is the new one. The new one it's flat, and then I bending like this, bending. Sabar nak, ayah lagi live. Ntar ya nak. Yeah, bending, and then they will have a good. This is the original. Still new. This is still already used. Okay. So bending like this. Then we can smooth in here. Okay. I'm not bring my burr because I don't have the burr. I only have a soft flex. So that's it for today. So let's turn on the comment, and okay, check first with this, yeah. Okay, this is dental floss. Let's see. Oh, very nice. See the contact. Ooh. Okay, and this one. Ooh. See. Ooh.